She walked in tired of seeing the changes of time. Wait for her results. The transformation is subtle, elegant, and completely real. Meet Sonia. Like many of our patients, she noticed her face no longer reflected how energetic she felt on the inside. Looking at her before photo, we identified a few key areas that needed attention. First, the jawline was starting to soften. That sharp, youthful contour was being obscured by early jowling and skin laxity. Second, the neck. There was visible relaxation and a small amount of excess tissue under the chin, creating a less defined profile. And finally, the cheeks had experienced mild descent, leading to a tired appearance and a deepening of the folds around her mouth. Sonia wanted to look refreshed and revitalized without looking done. Our goal was a natural, beautiful reset. To achieve this natural yet significant rejuvenation, we recommended a multi-pronged approach. The foundation was a combined face and neck lift. This procedure is the gold standard for correcting moderate to severe laxity. It allows us to carefully lift and reposition the deeper underlying muscle layer, which is crucial for results that last and look natural, not tight. We redefine the jawline and remove the excess skin and banding in the neck, which delivers that smooth, elegant cervical profile you see in her after photos. Volume restoration is key to anti-aging. We utilized autologous fat grafting, using Sonia's own purified fat cells to subtly enhance areas like the cheeks and around the mouth. This restores the soft, youthful contours that gravity and time have diminished. Finally, an upper eyelid surgery, or blepharoplasty, was performed to address the heavy, tired look around her eyes, brightening her overall gaze. Let us hear from our doctor, Hamdi Sakarya, about these procedures.
There are some signs of aging in the neck. For example, platysmal bands or neck bands, lax skin sagginess in the submental area, the chin area here, and also in some patients heavy, large necks. And our main goal in a neck lift surgery is to fix these bands, lax skin, and in some patients to reduce the heavy neck. The main goal of the facelift surgery is to fix some signs of aging in the face. What are these signs? For example, jowls, deep folds in the smiling region and around the mouth, skin laxity, and the saggy mid-face and saggy lower face. So as we know, there are two eyelids, upper and lower. When we think about upper eyelid surgery, we always should think with the eyebrow, because sometimes the main problem is not just the upper eyelid, but the brow descent. So the main goal is to restore the youthness of the eyelid area. To restore the upper eyelid area, generally we need to do upper eyelid surgery as well as brow lift surgery. Then we can get the best harmony.
The result is a transformation that speaks for itself. Her jawline is once again sharp, her neck is smooth and tight, and her overall expression is rested and vibrant. The most important outcome is that Sonia still looks like Sonia, just the version she remembers, refreshed and subtly refined. Now hear from Sonia herself.
Ho fatto un intervento di blefaroplastica superiore, blefaroplastica inferiore, più lifting del collo e mi sono trovata molto bene. Ho tolto dalla mia età almeno 10-20 anni e sto bene. Qui sono stati tutti gentili, coordinati nel loro lavoro, mi sono trovata molto bene. Grazie di tutto al dottore, grazie al suo staff, grazie a tutti voi.
If you're considering a similar journey, contact us for a private consultation today.